Hello everyone, welcome you all in this video lecture. So in this video tutorial, we are going to discuss about mitochondrial dysfunctioning and disease caused by mitochondrial dysfunctioning. So let's start with the introductive part. So before moving to the topic, let's understand some basic facts and some characteristic features about mitochondria. So basically the mitochondria is a double membrane bound cellular organelle which found in all eukaryotic cells, but it is not found in prokaryotes. And in the eukaryotes, it have a main function of ATP synthesis, and we know that ATP is considered as energy currency for all the cells. So that's why it is also called as powerhouse of the cell. Now the structure of mitochondrion is consists of an outer membrane and inner membrane. The space between outer and inner membrane called as intermembrane space, and inside the inner membrane the mitochondrial matrix, which consists several essential enzymes, metabolites and other ribosomes and genetic material in it. Now mitochondria play a very important role in cellular respiration, glucose metabolism and also in ATP synthesis. So we know that with the process of cellular respiration, it is the main pathway for glucose metabolism and also for ATP synthesis. With the help of citric acid cycle and electron transport chain, both the processes will complete in the mitochondrial matrix, and that's why it is also considered as one of the most important organelles of the cell. So now let's discuss about the mitochondrial dysfunctioning. So as we have discussed in our earlier slide, that mitochondria is considered as one of the most important cytoplasmic organelle in eukaryotic cells. Because in the eukaryotic cells, the mitochondria have the most important function of ATP synthesis and glucose metabolism. Because all the cellular activities need ATP as a energy currency for its proper functioning, and the mitochondria have the function to synthesize ATP. So basically, when the mitochondria cannot work properly due to some reasons, then this condition is called as mitochondrial dysfunctioning. So it is a condition where the mitochondrion cannot work properly, and when the mitochondria are not working well, they often the parts of the body to show the signs of poor functioning. So basically the mitochondrial dysfunctioning occur when the mitochondria lose the ability to function normally, and thus it can affect our body functioning and also it can show some signs. So the mitochondrial dysfunctioning can also cause several diseases in the particular organism. So now let's understand about the causes of mitochondrial dysfunctioning and what are the reasons for dysfunctioning of mitochondria in any cellular organism. So there can be several reasons for the dysfunctioning of mitochondria, and some reasons include the genetic mutations. We know that mitochondria have its own genetic material, which is called as mitochondrial DNA, and the mitochondrial DNA is always inherited from the mother into its offspring. So there are several mutations occur in the mitochondrial DNA or also in the nuclear DNA can cause different types of genetic mutations which cause the mitochondrial dysfunctioning. So basically it can be inherited from parent to its child, and the inheritance can be autosomal recessive inheritance in which the 25 chances for the child to get infected, and another type is autosomal dominant inheritance, and in this situation the child has 50% chances to inherit the mitochondrial disease. And another type of inheritance is mitochondrial inheritance. So here in that condition, mitochondrial DNA inherited from the mother to its child. So in that condition there are 100% chances that the child in the family will have mitochondrial dysfunctioning when his or her mother is infected by these diseases. So the another reason for the mitochondrial dysfunctioning include free radicals. So we know that what are the free radicals? They are the molecules which have outermost cell non-having 8 electrons. So basically they are the atoms, or they are the molecules having inadequate number of electrons in its outermost cell, and to complete their outer cell and to become inactive, they affect other cellular organelles or cytoplasmic organelles. So in that condition, the mitochondrial dysfunctioning also occur, and there are some lack of essential nutrients which are useful and which are very essential for the proper functioning of mitochondria, and lack of these essential nutrients also cause dysfunctioning of mitochondria. And there are certain bacteria and viruses which can cause also the dysfunctioning in mitochondria. So basically these pathogenic bacteria and viruses infect the mitochondria and cause improper functioning of the mitochondria. And there are several other reasons like stress or changes in the lifestyle and many other reasons for the mitochondrial dysfunctioning. So now let's understand about the symptoms of mitochondrial dysfunctioning. So basically the mitochondrial dysfunctioning causes different types of mitochondrial diseases in the particular cellular organism, and there are several symptoms also of the mitochondrial dysfunctioning. So these symptoms include fatigue, which is the most common symptom, because when the body have inadequate ATP synthesis, so the organism cannot work properly or it faces fatigue in doing any work. The another symptom is anxiety, depression, pain, lack of focus and mood disorders, and many other symptoms by which we can analyze the mitochondrial dysfunctioning in the particular organism. Now there are several diseases which can caused by mitochondrial dysfunctioning. So let's understand about some common diseases which can be caused by the mitochondrial dysfunctioning, which include several types of cardiovascular diseases, the learning disabilities, neurological diseases, diabetes, Parkinson's disease and many other. So basically the diabetes is the condition where the blood sugar level is not in control in any cellular organism. So there are two types of diabetes which are named as type 1 diabetes and type 2 diabetes, and they both can be caused due to the dysfunctioning of mitochondria, because we know that mitochondria have the ability for the glucose metabolism. So if mitochondria cannot work properly, the blood sugar level increases in the particular organism, which can cause diabetes. And there are several other diseases like Parkinson's disease, which is also a neurovascular disease caused by mitochondrial dysfunctioning. And several other problems include vision and hearing problems, several lung diseases, several movement disorders, liver and kidney diseases, and sometimes gastrointestinal disorders which can be caused by mitochondrial dysfunctioning. Now the question arises that how the dysfunctioning of mitochondria can be diagnosed. So basically there are several methods to diagnose the mitochondrial dysfunctioning and mitochondrial diseases in the particular organism. And there are several tests which are depending on the patient's symptoms and the areas of the body that are affected. So basically some common diagnosis methods include blood sampling, urine testing, MRI or MRS, and muscle biopsy. These all the tests are totally depends on the symptoms of particular organism. So the MRI or the MRS, which named for magnetic resonance imaging and magnetic resonance spectroscopy, are used to diagnose the neurological symptoms or to diagnose the neurological diseases caused by mitochondrial dysfunctioning. And sometimes electrocardiograms named as ECG, ERG and echo, also some other tests can be done to diagnose the cardiovascular diseases caused by mitochondrial dysfunctioning. The muscle biopsy can be done to diagnose the dysfunctioning of mitochondria or diagnose the diseases caused by the mitochondria, where the skin can be used by the affected part of the body. Now, what is the treatment for different types of mitochondrial diseases? So basically there is not any proper cure or not any proper treatment for mitochondrial dysfunctioning, because most of the time it is inherited or it caused due to several genetic mutations. So it cannot be cured by any conventional method. But there are some treatments which are used to reduce the effects or to cure the diseases which are caused by mitochondrial dysfunctioning. So these treatments can be used to cure the diseases or to reduce the effects, like there are several medicines used to cure diabetes or some neurological diseases which are caused due to mitochondrial dysfunctioning, but it cannot be cured totally. So these treatments may vary according to the diagnosis or according to the specific mitochondrial disease in the specific organism. Like if an organism having diabetes, so the treatments include blood sugar levels controlling, and if anyone diagnosed by neurological problems, so in that condition the treatments can vary in both the patients. So basically there is not any proper treatment for the mitochondrial dysfunctioning, but there are several supplements which are used or which are also considered as a treatment for the mitochondrial dysfunctioning. So these essential supplements which are very useful for the proper functioning of mitochondria, such as keratin, vitamins, alpha lipoic acid, several antioxidants and arginine. So these supplements are very useful for the functioning of mitochondria, and they can be used for the treatment of mitochondrial dysfunctioning. Like if the dysfunctioning is due to the radicals or free radicals, so that can be cured by the consumption of antioxidants or maintaining the level of antioxidants in our body. So basically there is not any proper treatment for mitochondrial dysfunctioning, but it can be prevented by adopting some methods. So the prevention from these mitochondrial dysfunctioning include the avoiding environmental toxins, because these toxins can increase the level of free radicals in our body, which can cause mitochondrial dysfunctioning, and these toxic materials also cause different types of diseases in our body. And the another prevention method is exercise, which include both endurance exercises and resistance or strength exercises. So some exercises including walking, running, dancing, cycling, or some sit-ups, arm curls are used to prevent the mitochondrial dysfunctioning. The another method is intermittent fasting, which is used widely to cure and to prevent the mitochondrial dysfunctioning in particular organism. And the minimizing physiological stress and improved lifestyle can also prevent the chances of having mitochondrial dysfunctioning in any organism. So these are some methods of prevention for the mitochondrial dysfunctioning. So in this video we have discussed about the mitochondrial dysfunctionings, their causes, their symptoms, treatment, and how to prevent from these diseases. Thank you.